For people who struggle with day-to-day activities, an occupational therapist can help them get back to normal. Let's speak with an occupational therapist from Faith Regional. I'm joined now by Zimmerman, an occupational therapist with Faith Regional Health Services. And I think we start at the beginning. What is an occupational therapist?
You bet. An occupational therapist is essentially somebody who works with anybody who's had any sort of illness, surgery, hospitalization, and they really need to regain those skills that they need to be able to go back home again, safely live on their own or with family.
What are some of the themes that work across the board that people are trying to improve on?
For occupational therapists, we're really focused in on those everyday tasks that people do. So if you think about it, after somebody has a surgery or is in the hospital for a period of time, they need to learn how to get dressed on their own again, shower on their own again, cook, clean, laundry, even if they're caring for a child, anything like that. So it's all those tasks that we're really working on them being able to do, again, to improve their quality of life and to achieve those goals.
Now, mentally, how do they handle these situations? Things they've been able to do forever, but all of a sudden can't? That has to be hard.
We really try to focus also on that, the emotional, psychological aspect of it, and really give them a lot of good feedback as they're coming along, and really involve them in goal setting too. What are the things that you want to be able to do to go home and live independently again, and really honing in and focusing on that. Also, a big piece of that is education, letting them know that this is why we're doing the certain activities. It's really explaining to the patient why we're doing certain tasks so that they can relate those to their goals.
What do your patients tell you when they're able to achieve goals? What's that like for them?
It's pretty amazing for them to be able to return back home and be able to be within that environment that they feel most comfortable. So it's extremely gratifying. I love what I do. I'm very gifted and blessed to be able to help these individuals return back to living on their own and being able to it's a quality of life thing for them, just to be able to do those things that they want to do on a daily basis.
And thank you so much for joining us today.
You bet. Thank you so much for having me.